executive director. So just as folks get started, you have your own power to mute and unmute. I will be muting myself very shortly to take care of this creature who needs my attention. But the chat is available for any of your comments and questions this afternoon. Or of course, if you have a question, you're welcome to unmute yourself and pop that in as well. So without further ado, I will turn it over to Stephanie, and you can go ahead and get us started. Thanks so much, Stephanie.
All right. Well, thanks, Rochelle. Good afternoon, everyone, and thanks for joining us for our kickoff event, Virtual Advocacy Days, a celebration of health centers. Normally, each year we would be meeting up at the Capitol and or one of the hotels real close to the Capitol for a day of programming and legislator visits. This year, we're doing things a little bit differently, and so we're pleased to have our health center advocates join us and our policymakers remotely. So today's event kicks off our programming, and we are joined by not only our health center advocates from across Wisconsin, but also some health center champions. I'd especially like to introduce our guests, Representatives Todd Novak and David Bowen, and TR, once a Whipkey, always a Whipkey, Williams. TR is currently the Deputy Outreach Director for Governor Tony Evers. And just so you know, I'm Stephanie Harrison, CEO of the Wisconsin Primary Healthcare Association, and we work with all the health centers across the state. So a few housekeeping reminders before we jump in. You are welcome to use the mute or unmute button on the lower left corner of your screen. My guess is you're all familiar with that by now. And if you're joining us by phone, you can use the *6 to mute or unmute. You can also put any questions you have into the chat, and Rochelle is going to be looking at the chat and making sure we can interject questions as we go. And so before we hear from our guests, I wanted to share a few health center highlights.
I'm gonna call. Okay.
From the past year. And obviously, health centers have been really all hands on deck with dealing with the COVID pandemic. They've also continued to provide all of their day-to-day services, medical, dental, behavioral health, and other services across our Wisconsin communities. Health centers are creative, nimble, and very community-driven, and these skills have served them well over the past year. So these highlights show just a few of the ways that health centers are meeting those community needs. So first up, with grant support from the Public Service Commission of Wisconsin and in partnership with the Great Rivers United Way, Scenic Bluffs Community Health Center in Southwest Wisconsin installed telehealth equipment in 3 rural school districts, which has meant more access to behavioral health services in schools and even providing continuous care when weather conditions are hard or pandemic conditions, as it were. Scenic Bluffs also partnered with Basketball Family Dental to open a new clinic in Basketball. The next slide, Progressive Community Health Centers hosted 3 drive-through flu clinics this past year. 40% of those who came didn't have insurance, which was a barrier for them getting those vaccines. In partnership with United Healthcare and the Alliance of Health Insurers, patients also got a $10 gift card for coming to get their vaccine. Family Health La Clinica, which is headquartered in Wautoma, Wisconsin, provides healthcare to migrant and seasonal agricultural workers across the state through 5 locations in its mobile healthcare unit. The Family Health La Clinica's partnership with the Wisconsin agricultural employers helps to maintain this very vital part of Wisconsin's economy by keeping workers healthy and safe. Next up is Partnership Community Health Center in Appleton collaborates with the Appleton Area School District on Project Hope, which is health outreach, prevention, and education. It helps students and families with healthcare and social services needed for both school and life success. Partnerships team works to increase access to care and remove barriers for low-income and high-risk students around transportation, access to food, and lack of insurance. As a result, many underserved children and families have improved health outcomes through this innovative program. And last up, We have Lakeshore Community Healthcare in Sheboygan and Manitowoc received a hydroponic flex farm system from Fork Farms thanks to United Healthcare. This means they can grow fresh greens for patients at their Sheboygan clinic. Each month, the mixed greens, healthy salad additions, and tips to maintain a healthy diet are shared with patients. Volunteers deliver the items and they are picked up at the clinic. It has been a way to engage patients in healthy diet and offer fresh greens to those in need of additional food. Now, I will say we could have spent the whole hour just talking about health center highlights because every single health center across the state has just been doing amazing and innovative work. But we wanted to also hear from some of our champions. So now we're pleased to invite several of our guests who will be joining us to celebrate health centers and share their views on how health centers are filling gaps to meet community needs. Representative Novak, we thank you so much for leading the charge to increase this the health center grant program this session. And we were wondering if you could share a few words and let us know what the state grant means to you and why you're championing that legislation.
Thank you, and thanks for inviting me to speak to you guys. I'm getting used to this Zoom, but I still like meeting people in person, so I can't wait until we can all get back to sitting across the table from each other. So a little about me, I have the 51st Assembly District, which is in Southwest Wisconsin. I have part of Grant and all of Lafayette, part of Iowa, Sauk, and Richland counties. I'm also the mayor of Dodgeville, still in that position. I became interested in health centers long before I ever became in the legislature. Simply, we have Access Dental Community Health Center in Dodgeville, and I helped actually they're right across from City Hall, so I see how busy they are. Helped them along the way. The city did after I took over being mayor, and it's been a tremendous asset to the community. So last session, as you're probably aware, I put out a bill with Senator Markline to increase grant funding to community health centers by $2 million. Unfortunately, we didn't, with COVID and everything, we couldn't get it to move as like we wanted. So I reintroduced it again this year with Senator Teston and I together because he's very big advocate in for community health centers too. He has some in his Senate district. The bill, it's AB 66, and it would increase community health center grants by $2 million from $5.49 million to $7.49 million. As again, like I said, Access, just to kind of give you an idea of how much they've done. When they started out in 2009, the staff consisted of a dentist, an hygienist, and a couple of dental assistants and a half-time clinical aide. Since then, they've expanded their staff. They have 3 full-time dentists, 2 hygienists, 6 dental assistants, and 4 others helping as support staff because of their success and the volume they're seeing. They've seen from when they started around 10,000 patients a year. Now they're seeing 70,000. And I can't stress how big a number that is for a rural area of the state. They are also right now in the process of expanding their facility. The city of Dodgeville is writing the grant for them, about a $500,000 expansion. So, but I really believe the community health centers all around the state provide a tremendous service when it comes to, delivering excellent care to those who are uninsured or underinsured. And, sometimes insurance plans do not cover dental or additional services that we all know about, and people just don't have anywhere to go. So I think that's the important part about community health centers, regardless of their dental or whatever they are. However, it's clear that providing, to me, I've seen the numbers, preventative care early in someone's life, like a child or anybody, that does not, has no access or no money to go to a dentist, that it pays off later on in their lives and actually saves the state, saves us money in the long run. And statistics show that. I've seen the figures. You take care of a young teenagers' teeth early. I'm just using teeth because that's what I'm doing experience with there. You know, you will save down the line possible Medicaid, Medicare issues because, you know, of what's going on. So I think that's the important piece for me. From a budgetary perspective, I feel that funding programs like this, these provided by community health centers, is a very prudent investment. Again, you know, and on behalf of the taxpayers. And that's my selling point when I talk to my colleagues on my side of the aisle, when I ask them to sign on to this bill and explain to them what this does for the community. In the, you know, the return clearly I've already seen in 12 years at my Access Dental Clinic is just unbelievable. So I'm really honored to push this. I really believe it'll get through, and I would like to acknowledge and thank the governor. He actually increased the funding in his budget this year. I'm fighting right now to hopefully keep the where he has it at right now. The bill, so we may not need the bill. I've already talked to the co-chair of the JFC and some of my colleagues on JFC, how important this is to try to keep this in. So hopefully we'll keep it in. If not, the bill has already been introduced. I believe they've had a hearing on it in the Senate. Representative Sanfilippo is a chairman of the Assembly Health Committee, has asked me when I want to hear this to let me know. He's ready to roll whenever my schedule's kind of wild right now. So I will expect this to go to the Assembly Health Committee in the next probably month or so. Whenever I ask Representative Sanfilippo, he's assured me he will hear it and exec it. So we will hopefully get this on the Assembly and Senate floor. Right now, I'm kind of just in a holding pattern because I want to see what happens with the budget, and you know, because the governor already has it in there. So in the protect mode right now to protect it in the budget. If not, I feel very good that we can get this through the both houses, hopefully this session, regardless. Like I said, it's a very small investment to me. In the scheme of things, I'm talking about a $2 million increase out of an $80 billion budget. So, you know, the payback, again, I can't stress that enough, which you guys all know. So appreciate everything you guys do too. So with that, that's where I'm at.
That's fantastic. We really do appreciate your support. And I understand you have to hop off a little bit early, but do you have a couple minutes for a few questions?
Yeah, no, I can stick around for a little bit. So no, that's no problem at all. I'd be glad to answer any questions that you guys have for me.
All right. So if any of the advocates have any questions, if you want to just raise your hand or put it in the chat, we will make sure to call on you. While we're waiting for them, I have a couple keyed up. So for legislators, most of the folks on the call are advocacy leaders, and so they're the ones that are primarily doing outreach with legislators and also trying to really drum up the teams of advocates at their own health centers. And so if you had any advice to give them about how to engage legislators that might not have a health center right across the street, what advice would you give them to help make the value of health centers known?
And that's something I deal with, you know, and I talk about health centers. There are legislators that don't have health centers in their district, so they look at me with a blank look. So I just sit them down and go through what's going on in my district. It does pique their interest. And I always tell people that are advocating for everything, it makes a difference to a legislator. And I know this for me personally, is to hear from real people, how community centers affected their lives, what you guys do. Versus like, nothing against lobbyists, but I would rather sit down and on any issue and talk to a real person or people on any issue on how it affects them. And I think that's how you need to talk to legislators. And like I said, I've done a good job talking to legislators that don't have community health centers to make them understand how important they are. And I don't, once they understand, I think I've got some people on this bill that don't have health centers. Once we talk to them, and like, oh, that's a good thing. So it's just understanding the issue, getting them to understand the issue.
Great. Another question I had for you was, how do health centers fit into some of your broader healthcare priorities this session?
Oh, boy, you know how to load questions for me. Well, this is, I think this is a priority for me. So where this leads, we've got a lot of healthcare issues to deal with right now. I'm co-authored the bill for pre-existing conditions and things like that. So this will fit well in that wheelhouse. And so kind of that's where I'm at on everything. As I said, it's early in the session. I know it's March, but as a legislator, things change daily. So anything I tell you today could change tomorrow. So I'm a huge healthcare advocate. So.
Oh, just hit the wrong button. Any advocates in the room want to toss out a question or comments too?
We have an appreciation in the chat, thanking Rep. Novak for his leadership on this issue. And we do have a question from Tony. Tony, if you'd like to go ahead.
Yeah, thanks a lot for your support. I just have a question in terms of for when you're speaking with your other representatives, what are their concerns if they may not support the bill? Are they concerned about the 2 million, or is it more of a like an educational standpoint from us advocates, or what's the concern if they may not support?
Well, in my, not going to dish my party because the governor's office is on here, and so is Representative Bowen, I assume. But I have some very budget hawks in my colleagues, and that's well known. It's not a complaint, but so when you're talking $2 million, which I said to me is not in the scheme of things, I need to explain what that $2 million is doing and show them on paper how much in the long run this is saving us, and then they get it. And another thing, to be honest with you, it isn't as much the money is the legislators that don't have a community health center know nothing about them. That's probably a bigger roadblock to me than essentially the $2 million increase. So it's just a lot of education. I have a lot of more urban areas that don't have health centers, where I believe most of them, you may have statistics or numbers better than I do, and more in kind of the rural areas. As far as my colleagues, I guess I should say. So that's a big thing with me, is just explain what a community health center does to people, that my colleagues and friends that don't have one and don't know anything about them.
Thank you.
And there is additional appreciations in the chat. And so Eva mentioned, thank you for your dedication to this legislation and to health centers, recognizing it's been a little over 10 years since we've had an increase. And so it's really very appreciated that you're taking this on. And she also mentioned if there's anything we can do to help, not to be sure to reach out and ask, because I think we've always tried to pitch the health centers as kind of the easy button. And so if a legislator is running into a healthcare challenge, call your health center and see if we can help figure it out.
I think the biggest help you guys can give me is if you go to find. I have a map of where all the health centers are, and you need to contact those legislators. Most of them are on the bills, and have them talk to their we all have a budget buddy, we call it, somebody on JFC that we work with, and have those legislators that may not be on the bill but have a community health center in their area contact their budget person, and kind of work it. If you guys could help me on that end too, kind of go through everything. And I don't think this is a political hot potato. I don't see much division between the Republicans and the Democrats on this issue. It's just more informing people what's going on and making them understand. So if that makes sense.
Very good. And there's also some appreciation and kudos from Representative Bowen in the chat. So thank you. All right, any last questions, or otherwise we will go on to our next speaker.
I'll stick around for a while. I want to hear Bowen talk about how great I am, if I can do that. So is that okay?
That's totally fine. That is totally fine. Yeah, so at this point, we are ready to turn it over to Representative David Bowen, who is actually on a community health center board. And so I was wondering, Representative Bowen, if you could say a few words and talk a little bit about how you ended up deciding to join a community health center board.
Awesome. First off, thank you guys so much. I am just on the block of the square parking here. So I want to go ahead and get that out the way, and then I'll be able to turn my camera on. But first off, thank you guys so much for having me. And I am very appreciative of Representative Novak. I hope he knows that. I know he has a heart for service. And, my decision to get on a health center board was very much in line of just understanding and knowing the impact that you guys make daily in the lives of so many. And at a time when, we want to see the expanded access to healthcare and services be much more sound and throughout all of our community throughout the state. So I'm totally ecstatic to be able to work with some superheroes, I call them, on the Outreach Community Center Health Center Board. Dynamic individuals right in Milwaukee, and it's increasing my involvement and awareness of just how needed these services really are, and different parts of our state that very much could benefit from the needs of having a health center, a federally qualified health center, more accessible. So first off, I want to highlight that, and be able to just talk about how important healthcare is to our state. We are thankfully one of the states where healthcare is run really well here, and it's just about making sure that more and more people have access to it, no matter who you work for, no matter how much money you make, and trying to ensure that folks get access to care and services are really important. Federally qualified health centers do that. They close that gap. And I think as you guys have highlighted, we have a number of obligations to be able to take care of as a state. And we do that every 2 years with our biennium budget. I hope that we'll be able to find the buy-in to be able to get more and more resources to you guys to be able to continue to do that work. I find that highly important. So I am just here on the square, and want to make sure I get a chance to take any questions that you guys have.
All right, well, I let our advocates formulate those questions. I do have a couple in my deck for you as well. And so I was curious to know how health centers might fit into some of your broader healthcare priorities.
Absolutely. I think one of the biggest things that you'll see bipartisan support is, as a state, we've made more and more advances into investing into mental health services and getting more resources to our communities to be able to do that. I appreciate the fact that we've made some gains in doing so. And there's some big policy differences, right? There that we can't ignore, especially when it ties to some of the federal priorities that we've had that highlight where things stand when it comes to healthcare and things of that nature. But I think for the most part, still trying to find a way that we can move in the direction of having access to more federal funds that will benefit all of our communities. Doesn't have to be tied to a certain bill name. It doesn't have to be tied to some of the personalities that we see in DC. But we do know when we are able to open that faucet, that support for our communities from the federal level really does lift the burden off of the state to be able to couple other funds into the investments into healthcare. So that's some of the things that I do prioritize, that we can find a bipartisan solution to getting more federal funds accessible in our communities. It greatly can help expand healthcare. And one of the things you might not know, I serve on the corrections committee, and what we did see is that recidivism itself is increased when you have lack of access to care. You have lack of access to mental health services. And, we've been able to have some really forward conversations at the state about expanding things like telehealth that right now are doing very well and make have access to state and to keep things moving in the right direction.
That is great. We may flag that for future conversation because we have some health centers that are very interested in the re-entry work. And so really connecting people to Medicaid coverage so that they have a smooth transition when they're being released, and also getting connected to a source of care to make sure that we do have as much continuity of care as folks are being released as possible. And also our, and I'll save this one.
We can do that.
Pardon me?
I said, absolutely do that so we can work on that together.
We will
And I'll
definitely
make
follow
that
up.
to Rep. Novak, who's also on there. I think he said the governor's office is here too. So maybe that could be a 3-for-1 right there.
There you go. And just a quick bit of advice. So how you found out about community health centers, and if you have advice on the best way to hook a legislator in the very good work that community health centers are doing in their communities.
Repeat that question one more time.
So obviously you got hooked into community health centers by serving on a board, but if you were going to give some advice to these advocates about how to connect their legislators with the great work that they're doing, what advice would you give them?
First and foremost, it's sharing the information. It's ensuring, and I hope the wind is not too windy here outside. It's about making sure that folks at the state are able to understand just how much of an impact our centers are really making in the everyday lives of Wisconsinites. Sometimes things can be just uniform, and you just kind of just take for granted of how much impact is actually being made. So being able to highlight that to legislators is so important. And we have a lot of folks that talk to us every session. So why not have advocates of health centers right at the forefront, feeding us that information that we know that is so important, that impacts our residents, impacts our constituents. So I would say that first and foremost, and to do the work that we know that you take a lot of pride in doing, a lot of joy in doing, and be able to connect that with folks in the Capitol that are making decisions. Sometimes we do need to make decisions with our heartstring and our wallet, right, at the same time. So it is possible. I think we know as a state, definitely dealing with this pandemic of just a toll that it's taken on our communities, and trying to find this balance where we can make investments, but also take care of the state's coffers and make sure that we are making sound decisions. I hope that we be able to do that. And I think Rep. Novak is a testament to that too.
That is great. Do any of our advocates have any questions for Representative Bowen? All right. Can you join? Do you need to hop off at this point, or are you going to join us for a few more?
I can join you for a few more. I'll just turn my camera off and go on mute, and then keep in touch with the communication.
Great. So we might have a few more questions once we've made it the full round. So at this point, I'm going to turn it over to TR Williams. And so TR, as I mentioned at the beginning, is the Deputy Outreach Director for Governor Evers. And many of you know her as a close friend of ours, having once worked with us. So TR, could you tell us a little bit about how you and the governor see health centers fitting into our state's approach to addressing healthcare needs in Wisconsin?
I most certainly can. Thank you, Stephanie Harrison. I have been trying not to cheese during this whole time and looking goofy while cheesing, but I am so excited to be here, to see you all's faces. I'm like looking at people. I'm like, Tony, Eva. So it is good for my heart. I think the way that Stephanie introduced this, that she is right. Once a Whipkey, always a Ripkey. I think that one of the things that I have always been excited about when it comes to health centers is that it can do exactly what it's doing now. As Representative Novak and Representative Bowen are speaking, I'm nodding my head. I'm like, yeah, that's all agreement from the governor's office as well on those things. And during these times where we don't see that a lot, I think that is the combining power of what community health centers do. And that's the basis of what the governor sees as their value. This was an extremely hard year for Wisconsinites. People lost their lives. People were in dire need of basic needs, right? And I'm not one to say that that doesn't always exist, but COVID-19 certainly exacerbated what that was, and community health centers were there from the get-go, doing exactly what they've always promised elected officials they can do, which is to push that easy button. When I was deployed to the State Emergency Operations Center, right away as I got there, community health centers were already in the conversation. Family Health La Clinica specifically was able to step up in an amazing and awesome way when it came to testing, education, and rollouts of information on the virus for our migrant workers and the population that they serve there. And so the governor's office sees community health centers as that perfect sort of intersection of what is the sexy term of all these social determinants of health, right? Understanding that people's lives and how they live their lives impact their health, that your body and the things that you need, or your teeth, as Representative Novak said, those things that you have are not separate from how you're getting food, from how you're getting to work, to all those other things that allow you to live your life. And so the governor sees the community health centers through that lens, values the work that you all have continually done, and always seem to be willing to do, even when we say one more thing, one more thing. And so it is with much excitement and pride that the governor included community health centers, increasing of the state grant for health centers by $2 million in his budget. It's with that same pride and excitement that he has included dental therapy, as I know WPHCA has been a leader in that coalition and bringing a unusual group of folks together all in one to see the value of that. And also, as Representative Bowen has alluded to, Governor also increasing telehealth services there, and looking for a way to increase private coverage of telehealth services as well in his budget. And so, yeah, you all are all throughout the budget in a lot of ways that's inspired by the work that you do and the willingness that you all have always had in, regardless of what the small p or big P politics are, ultimately being here for the community and for serving Wisconsinites exactly where they're at so that they can reach their aspired health goals.
That is fantastic. Wouldn't we love to see that happen? All right. Well, advocates, please make sure to put your raise your hands or put questions in the chat. We'd like to make this as interactive as possible. And while I'm waiting for you to come up with questions, and I know you can, just wanted to pose another question to TR. So what other priorities in the governor's budget are relevant to health centers or to health equity? We've also been talking a lot about health equity and some of the disparities that have been plaguing Wisconsin for a long time, but specifically in the last year.
Yes. Lots going on with health equity, and I'm so excited to hear WPHCA being a leader in that space. and even more so, to be honest, not just hearing it from WPHCA, but hearing it from others, which is a testament to WPHCA and to all of the advocates on the call, that if I'm hearing it from someone else that is not you all, that means you're doing exactly what you need to do in that space, and that warms my heart. So I would be remiss if I didn't mention that the governor is in support of Medicaid expansion. Nothing has changed on that end from him, being able to have that access for coverage of Wisconsinites and really being able to follow what Wisconsinites are telling us. Medicaid expansion being something that is across the state, something that's supported by the people. Also, governor's budget, including the private option, which is, again, something that may have not fallen in the sexy category there, but something that the governor is certainly excited about. Public option, excuse me, not private option, public option health plan, which the governor is excited about. Also, when it comes into the health equity space, there are several initiatives that the governor's budget proposes that includes funding specifically for organizations that are focused on maternal and infant health disparities, knowing the statistics we have of Black moms and Black babies, and wanting to be able to do that work. So there is earmarked money for that the governor has supported. Also supporting specifically organizations that are ran by communities of color that's focused on health outcomes. Additional funding for healthy women's healthy babies as a whole, which we did see in the last budget that the governor put out, that's back here again. And something that both came up on Representative Novak and Representative Bowen's sort of list of things is the governor's investment in mental health. So looking at $54 million alone in school-based mental health programs, where I know a lot of community health centers have spaces where they've had that connection with or schools or in the schools in that way. So supporting those school-based mental health programs is something else that the governor is very much excited about, as well as his overall mental health investments for caregiving and long-term care as well.
Sounds great. Do we see any hands, or am I going to pose another question?
I mean, if not, I'm going to call on people. I know the amazing, awesome advocacy leaders have a question for the governor's office, because advocates know that the nature of what they do is to create tension between sources of powers and the needs of the people they represent. So I know they have a question for me, Stephanie. Oh, Angelica is giving some love in the chat. I see that too. We can take that too, Angelica.
TR, I do see a question from Chris at 16th Street, wondering if we know when LFB will release analysis for the budget. Do you have any word on that? I think we're all at the edges of our seats to see if that'll be next week or later in March, or what to expect.
Good question, Chris Rosh. I don't know, but you know what? I will make that note, because I do think that may be something that I can follow up with Rochelle on to share with all of you.
And I'll throw another question at TR. I think one of the items that health centers are hearing a lot about, and that is, really seeing some bipartisan support, is around broadband and high-speed internet access in the state. TR, do you see that as an item that's got a lot of legs to move forward in this budget? We think about it for telehealth, but hoping you could just talk us through where you see those budget provisions going.
Yes, this is the year of broadband. The governor is super excited about it. When we have talked to stakeholders, whether they're in urban or rural areas, and really, honestly, regardless of their background, I think personally that broadband expansion is one of the most equitable policies in the governor's budget. And so there is that excitement around there. In doing sort of the WIS Politics Wheeler Report review of some initial comments that came from the governor's budget address, it seemed to be a lot of energy around elected officials on all sides of the aisle regarding that broadband, because like I said, I think it touches people in a way that everyone can understand, kind of like community health centers, especially if we're talking about increasing mental health services and telehealth. We can't really have that conversation without broadband. And so in the governor's budget is that $200 million price tag on a broadband initiative, with $150 million of that being specifically for expansion grants. I would also add, one of the questions that was posed earlier is, how do folks work with elected officials who don't have a health center in, their district proper? And I would say that what this pandemic has highlighted and what the governor has seen, which is why he's such a fan and supporter of community health centers, is that even if you don't have a health center in your district proper, know that that health center is working some way in your district, whether it's the people that they're serving in some shape or form, or the residual effects of that whole life living type of work that community health centers do, is that impact is felt throughout the state, despite the fact that there are only 17 brand health centers and 120 plus delivery sites of that health. Health centers are really all across the state in some shape or form with what the work that they're doing.
All right. So, well, my last question for TR, and I'm not seeing TR. You're gonna have to call on people next. But my next question for you is, what advice would you give our advocacy leaders going into this session, given that we're not going to be able to pound the halls and walk the halls and knock on doors? What are some of the best strategies you've seen in terms of engaging with legislators?
I would say for those who might have always had a little bit of butterflies in their stomach about talking to people in person, this is your cat's meow now, right? This is the time where you can do those emails, or you can make those calls, where you don't have to worry about in the moment having to come together, but you can prepare things. I think that even more than before, there's an openness for other ways in which you can meet or have a touch point, right? Which doesn't have to always be pounding the pavement. And for those who pounding the pavement and doing those in-person visits, I'm looking at you, Tony, for those people who that's your thing, I think that making those requests for a virtual sort of meeting like this is totally within fair game of asking of elected officials. And I think that especially because of the virtual nature of how things may be, that the advocate's responsibility at this point in time is to continue beating the drum on the budget. Representative Novak used the word of protection when it came to the community health center grant. I think that that's a good point, is that the things that matter to you all, you want to make sure that you're able to keep that messaging maybe a little bit longer than you're used to, right? Because most times there's excitement around the Capitol. There's going to be these in-person, listening sessions or budget hearings, and then, things are kind of getting done. I suspect that the nature of the virtual environment and the ongoing pandemic is that we're going to have to keep the energy up about the parts of the budget that you like way longer than just March and April. So pace yourselves, but be in it for the long haul. And Eva, I did see your question about maintenance when it came to broadband. The details of maintenance are not worked out in the budget as a whole, but that is a good point. And I would say that it's not something that hasn't been discussed or thought of.
And Eva did pop another question in about the budget hearings planning to be in virtual or in person.
That is the legislature and Joint Finance Committee decisions there of how that's going to look.
I can chime in on that one real quick. We don't know yet, so we did just have a conversation with Senator Mark Lyon's staff last week, and we know there are lots of input and considerations in how to run those this year, so we don't know yet. And I think another item, we're on the edges of our seats to figure out what the opportunities are for public engagement in those processes. I don't know, maybe I would turn that back over to if we still have Rep. Novak and Rep. Bowen, which I believe we do. If you have any additional information to share on that item, we'd be delighted to hear more if you have something to add.
I can just add a little bit. Senator Markline's my senator in my district, but he's the co-chair for the Senate side, so I actually don't deal with him on JFC stuff. I've been dealing with Representative Bourne. I know that the public will have their chance at input on the budget, and I think what I'm understanding is they're working out the details of in-person, hybrid, via Zoom. I don't know, but there definitely will be opportunities for the public to have input on the budget, from what I'm being told on the Assembly JFC side. So I'm assuming they're working that out right now.
I think for whatever powers that be are in this room, I think health centers are really strongly advocating for some Zoom options. That also gives us the opportunity to potentially get patients or board members involved in conversations that they might otherwise not be able to engage in. And so to the extent that that's in the works, we would love to see virtual options continue. All right, I'm checking the chat. And Rochelle, are you checking the chat? Are we seeing... So Chris also
an appreciation from Chris as well on items related to property taxes and lead abatement. So sharing that as well.
Tony, were you about to say something?
No, I didn't know if Chris had a question first before I asked TR a question.
I think it's all you.
I thought that Rochelle had, okay. No, it's not about the budget, but my question is more focused around ACA and the outreach effort that the state and maybe OCI has with alerting everybody, the Wisconsinites, about the new open enrollment.
That is a good question. I know that OCI has been doing some conversations, or has been having some conversation with our comm shop about that. I don't have much visibility on it, but that doesn't mean something's not happening on it. So other than the Fiscal Bureau papers, I'll also ask about that, Tony, and then share that with Rochelle to get back to you guys, you all.
Great.
And TR, one more question. This is not on the list of approved questions, so
going out rogue, Stephanie Harrison going rogue.
I'm curious to know, do you have the capacity to not only track any feedback from budget things, but also any recommendations from health centers around the ongoing COVID response?
So yes, that's the short answer is yes. There's no wrong way to provide feedback to the governor's office on the ongoing COVID-19 response. That's exactly what we need to hear from folks. I would say that maybe the more formal channels there is the COVID response team at DHS, but folks can certainly feel free to just use my email to share things with me. And also more specifically, willing to hear feedback on any of the programs that we've done over the last year from Fed monies, with anticipation that there may be more Fed money. That feedback of, hey, this is how you all set up that program, which ideally sounds like it would work, but on the ground, this is actually how it went down. We got quite a bit of that about the RAP funding, the Wisconsin Rental Assistance Program. So if there are those types of concerns specifically, not that I'm saying exclusively only those, feel free to share those with me.
All right. Sounds great. Thank you.
Do we have any idea how much more federal funding is coming?
I'm sure Zach Madden in our office has his thought process on it, but as far as what's out there public from us, I don't think we do.
Thanks.
Sorry, Zach Madden's our legislative director, who also plays in the federal space for the governor's office as well.
All right, so I think Representative Bowen had to sign off, but this is sort of a last call. It looks like we still have Representative Novak and we still have TR. Any last questions or comments from the group?
Hi, everyone. This is Joanne Holland from Access Community Health Centers, and I just want to appreciate the opportunity for us to come together today. It's just a wonderful opportunity to share more about what health centers are up to and the support from so many stakeholders, starting with our legislators and what a difference it makes for us and what we're up to. And this is just a shout out to Representative Novak, also known as Mayor Novak. Thank you for your support of the good work that we're planning for our Dodgeville Dental Clinic. We're just so thankful to have had you there as a neighbor for so many years. Really looking forward to some of the expansion efforts that we're planning in the next year, and your local support and broader support also as a state representative really makes a wonderful difference. I just wanted to say thank you, and for everyone else to know about the good work you're doing.
All right, well, that seems like a very nice note to transition things back to Rochelle for a brief wrap up.
Thank you so much, Stephanie. Thank you, Rep. Novak and TR for joining us today. And of course to Rep. Owen, who noted he had to jump off to read virtually to kids, which I think is the best reason I could consider jumping off a Zoom meeting for. So pretty wonderful. But appreciate advocates joining us today. I just want to wrap up by reminding folks that we do have additional programming coming up over the next 3 weeks. So our next event is tomorrow, same place, same time from noon to 1. We are doing our Advocacy 101 overview with former lawmakers Jen Schilling and Mike Rohrcast, talking through tips and tricks for engagement. That is a great session for anyone who has not engaged with the lawmakers before or wants a refresher. So that will be tomorrow, and then we'll continue to have programming throughout the rest of the month. Very exciting, leading up to lawmaker engagement again virtually on April 1st and 2nd. So please reach out to myself, Carly, Sashi, other folks from WPHCA at any point with questions. And we just appreciate having this great chance to kick off, celebrate the work that health centers are doing across the state every day, and celebrate some of our champions as well. So thank you all so much for joining us. Any questions or items before we jump off today? If so, add them to the chat or unmute and let us know. All right, well, wonderful. Thank you so much for joining us, and we'll look forward to seeing you all virtually again soon. Keep up the good work. Thank you.
Have a good one.
Thanks, everybody.
Bye, folks.